Today I'm here to talk to you all about a nationwide problem. There are over 901 million people worldwide over the age of 60. This number is only predicted to increase as the years continue, reaching 2.1 billion by 2050. Healthcare systems must be efficiently set up to respond to this growing number of people and their medical conditions. Today there is a gap between the increasing patient need and the nursing care available to meet those needs, though. At some point in your lives, you may be a patient in a hospital and experience the effects that occur when a nurse cares for too many patients at one time. I recently have seen firsthand the effects that uncapped staffing ratios can have. I have also done extensive research on this topic, and I found an abundance of information to support these ratios. I am here to tell you that a mandated nurse-to-patient ratio needs to be implemented in order to benefit nurses, patients, and hospitals. I do not think you realize how nurses are affected from taking care of too many patients at one time. I do not think you realize the dangers and neglect that occur to patients due to uncapped ratios. I do not think you realize the money that can be saved with these ratios. I want you to see that there are only benefits to be had by implementing nurse-to-patient ratios. States like California and Massachusetts have already taken action and implemented these ratios. They realize all the benefits that there are to come from these ratios and want people to experience them. Like nurses, they only stand to gain from these implemented ratios. The quality of care they give significantly improves when ratios are implemented. Their overall job satisfaction improves when ratios are implemented. Nurse burnout occurs less when ratios are implemented. It only seems logical that if implementing these ratios provides this many beneficial outcomes for nurses, which in turn makes them want to stay in their job longer and allows them to provide better patient care, then they should be implemented. Patients will only have better outcomes due to mandated ratios. Increased nurses are associated with a decrease in patient adverse effects, like hospital-acquired pneumonia and nosocomial bloodstream infections. Patient mortality rates have decreased due to implemented ratios. Nurses are able to spend more time with their patients now, which means they're more likely to detect early signs of deterioration, including changes in their patient's vital signs, skin color, and breathing pattern, all before it's too late. If ratios can save even one person's life, then they should be implemented. Unfinished tasks like patient teaching and counseling, skin and oral care, documenting, and discharge planning are long forgotten with an increased workload. Not completing these tasks has a direct effect on patient safety. Medication errors, including the administration of the wrong medication or the wrong dose of medication, also occur with an increased workload. When the patients stack up, there are bound to be those who are neglected or given less than they deserve care. This issue needs to be taken care of before it gets worse. Hospitals should be jumping to implement these ratios. Hiring more nurses will be cost-effective for them. Increased staff will lead to reduced patient nosocomial outcomes, which lead to a shorter lengths of stay, which results in medical cost savings. Take a complication like pneumonia, for example. It can add 5 days to a patient's stay, at $4,000 to $5,000 per day to treat. Increasing nursing staff will have a better chance at preventing these outcomes, which will lead to cost savings. Inadequate staffing levels also lead to nurse turnover, and turnover is expensive. The average cost to replace an RN averages about $85,000. Increased nurse staffing will reduce turnover and save hospitals money. At what point are enough patients per nurse enough? Every state needs to follow suit and implement these ratios. By implementing them, nurses will be able to provide better care. Their job satisfaction will increase and burnout will decrease. Patient safety will be improved. Patients' lives will be saved and hospitals will experience medical cost savings. Healthcare facilities need to implement these ratios now in order for the effects to start taking place. People cannot experience all the benefits these ratios have to offer if no change is made. I urge all of you to take a harder look at just what is happening in the healthcare field. It could be one of your loved ones, or someday in the future it could even be you. I hope I have opened your eyes to just how important mandated nurse-to-patient ratios are, so let's advocate for these ratios now before more people have to suffer.